My name is Bhavdeep Singh, and I'm with Fortis Healthcare. We're based in India, and I'm the Chief Executive Officer. I had the opportunity to come speak at the conference, and I think it's been very interesting to be able to share Fortis Healthcare story with all the delegates, all the attendees here. And what I've been quite impressed with is the feedback. A lot of people want to come and understand what's happening in India, what's happening in Fortis, and why potentially what we're doing is a significant piece of the medical tourism story that's taking place in the world today. Sure, when you look at Fortis Healthcare and you look at the medical tourism industry, the reality is just like everybody else, we're just starting. There's a lot more to go. I think that conferences like this, events like this, raise awareness of what's possible. Because everybody that you talk to, it seems like everybody has lots of dreams, lots of aspirations. It's interesting to find people here, large organizations like ours, and organizations that are doing different things, smaller, bigger, whatever it might be. But you have a little bit of everything here, a little bit of everything, and then lots of people from different walks of life. And I think there's lots of optimism around the message, whether it's a message that I've shared or anybody else has shared, and people are just quite optimistic that this is potentially at least a part of the solution to the healthcare challenge we have in the world today. I think, having a conference like this, having an event like this that's been organized here in Los Angeles, it brings people together. And I don't think you could quantify it by how many deals have been closed today or yesterday or the day before, but I think it's probably important what happens in the next 60, 90 days. All the business cards, I know that, in my room upstairs, I probably have 90, 100 business cards. I'm sure everybody does. And it's actually the conversations that take place after this that measure the impact. But I'm sure things will come out of this. You won't know exactly what happens today, but 3 months, 6 months from now, I think if you look back, we'll probably find that certainly some deals came out of it, some relationships came out of it, and things that will be sustainable and probably create some good value for everybody in the future. This is my first trip to the Medical Tourism Congress conference here, and I certainly think there's some value here, and I'm sure that as an organization, the Medical Tourism Conference will be looking for feedback. What are the great things that are happening here? What are the things that as an organization, as attendees, as participants, how do you make sure that it gets better and better as time goes on? I think that the sessions are good. I think when you look at the Congress conference here on medical tourism, I think that the sessions have been good. I think the venue is good. But I think the best thing that happens here is the networking and the ability to meet. I've met everybody from hospital operators, insurance operators, media agencies. You're meeting just about anybody who touches healthcare and who potentially can have a role to play as we move forward in the area of medical tourism. So I think the networking piece is a great piece, and probably the piece that we all value the most. Fortis Healthcare is an organization that started only in 2002, and we are today the fastest growing healthcare provider in Asia. We have 48 hospitals, almost 10,000 beds. We are an organization that's building a brand based on quality and healthcare and great patient outcomes. So I think that for anybody who's just starting to hear about Fortis, the one thing I'd say is that we're here to stay, lots of good things to do, but more importantly, the disease burden that the world is facing today, the challenge in healthcare cost, I think that organizations like Fortis have an opportunity to play a key role in taking good quality healthcare to more and more people around the world. When you look at the patients and the patient profiles for the people that come to us, you have a combination of cardiac disease is very big. Patients getting angioplasties, getting cardiac surgeries done. Knee replacements, joint replacements is quite significant as well. And then the one that gets a lot of press is the whole piece on cosmetic surgery, and it's not as big as you would think. I think it's getting bigger and bigger as time goes on. But I think the more interesting piece is that as time goes on over the next 2, 3, 4, 5 years, I think it's going to be more and more driven by need. And cancer is going to become quite significant. I think neurosurgery is going to become quite significant. So I think it'll really start spanning the broad breadth of medicine as opposed to anything specific. But I think that's an evolution kind of type of thing, and it'll continue to change as time goes on.